The goal of fractionated resurfacing is to reduce the downtime, first and foremost, and diminish the problems that we've had with resurfacing, which are delayed hyper and hypopigmentation primarily. We didn't used to think that we'd get that with the traditional resurfacing with carbon dioxide lasers, but in fact that has been the case, and you don't see it until a period of time after. You also see different things that happen with resurfacing, such as prolonged erythema, prolonged healing, and some difficulties. Fractionated resurfacing seems to have eliminated those problems. The post-operative or the post-treatment course is much better with fractionated resurfacing. Who's the right candidate for Pixel Perfect? I think that we're going to see skin types 1 through 5 perhaps. I think that that's what it's cleared for. I feel confident in doing that to refresh the skin, to rejuvenate the skin in a relatively short period of time. I'm really enthusiastic about the product. So far, everybody that we've done it to has been quite enthusiastic as well.
What prompted me to look into this treatment was probably my lifestyle and my job. Over the last 30 years, 35 years, I've been very active, athletic outside, from golfing, skiing, other things like that, water sports. And then my job, I also do a lot of design work outside, and so in the construction field, so I tend to be in the sun more. And I think as I've gotten older, I've just noticed the age spots and other things, sunspots that tend to come up that used to go away when I was younger, when summer ended, and they don't seem to go away as much as they used to. They seem to last year-round. And so I was looking into a procedure that might clean those areas up and give me more of a youthful feel, I guess, and look. I think as far as what my outcome or what I hope the outcomes are going to be is I've never been one that's really interested in looking younger so much as just looking good for your age and looking maybe refreshed. I know currently I'm engaged, and so we're looking at getting married towards the end of this year, and it would be nice to look a little refreshed and look as young as possible for that maybe. But I think overall it's just looking good for your age and looking to look on the outside as fresh and as good as I feel on the inside, and that's what I'm hoping for. It's about maybe a half hour since the surgery or since the procedure, and I'm feeling very comfortable actually. It's no more than maybe a sunburn coming home from the beach, and you can feel it a little bit, but it's just a warm sensation and very comfortable actually, much more than I thought it would be. The treatment, I was sharing with you during the treatment that for me it was actually more of an irritation than a pain. It's just very small little zaps, and you feel little stings, but mostly the numbing cream really helps a lot. Most of them you don't feel that much, and occasionally when you get to the outside, the edges around the hairlines or the perimeter of where you might have had the numbing cream, you can start to feel a little bit more. But it's all very, like I said, it's no more than a little rubber band snap. It feels about as extreme as it, not much more than that.
I'm actually most interested in some work in the neck area where I've just noticed some crepiness start to creep in the last year or two, and followed by the area of my forehead, and then nose to mouth lines is where I'd like to see some improvement. My expectations are that I hope to see tightening of the skin in the areas that I just mentioned. Actually even a little more clarity and luminosity in my skin also I would hope to see. And then if I could get a little bit of improvement in the area on my right cheek where I actually have some broken capillaries and a tiny bit of rosacea, that would be terrific. I was expecting to be able to have to hide for about a week, but in actuality I think I'd feel fine going out tomorrow. I don't know if I'd want to be, somewhere in the great of the public eye, but I certainly would feel comfortable being around my friends and some associates. It was actually really tolerable, and if I had to rate it from a 1 to 10, I would say it was probably somewhere around a 2. And particularly as you moved in from the hairline, where it was a little more sensitive, into the center of the face, the center of the neck, you barely felt it at all. I'm really happy I did it, and I'm looking forward to seeing the results, particularly in the neck area and the chest area where I was really experiencing a lot of crepiness and that sort of thing coming from age.
I think, as you could see, that what we did on the last 2 patients, where we treated with a couple passes in the areas where the wrinkles and crinkles were. In the rest of the area, we just treated with one pass, and I would expect to see resolution of mild dyschromias that are all in the epidermis. I'd expect to see some nice response as far as sun damage, which again is primarily epidermal in nature. We're looking forward to really seeing nice results with the Pixel Perfect CO2 machine. We were happy with the erbium. It was a very safe, comfortable method to do that provided nice resurfacing. But what we'd like to do with the Pixel Perfect is even cut down more on the number of treatments that we have to do and really get people out faster. I was really surprised to see how good these people looked in just a couple of days, really. The redness had faded almost quicker than the erbium, and yet we have that underlying glow of inflammation that we're hoping will do a fair amount of work.